We're here in the European herb garden, and the design of this garden reflects the medical thinking, Western medical thinking, and so it's laid out according to parts of the body and disease patterns that affect these parts of the body. In a sense, it's a fairly reductionist method of thinking, and this applies to the plants also. So if we look at some of the plants, say in this section, heart and circulation, we start here with this hawthorn. This is a very well-known herbal remedy for the heart. We'll see this again, and I'll discuss more detail in the Chinese garden, but the fruit of this plant is known as heart medicine, and it has many actions. We'll see that later. If we carry on through here, we see a plant that's very well known in heart medicine, the digitalis. This is one of the first drugs which was developed from herbal medicine in 1700s, and this plant has a very powerful cardiotonic effect to stimulate the heart. So this was the first drug called digoxin, which was developed from this particular plant. That process has continued with many of these herbs as part of the, as I say, the reductionist method, where you try and isolate the active chemical, you concentrate it, and you then apply it to disease patterns. A very powerful system, very effective. We're in the ear, nose and throat section, and the plant here you will all be familiar with. This is common sage, Salvia officinalis. This has been used for many years as a throat gargle, and it is very effective. The reason is it contains very strong antibiotic essential oils. This is why it smells so strongly. So there's obviously a chemical in here which has been identified. However, recently they've discovered that this plant has some effect in Alzheimer's disease. Now this is not due to obviously this chemical. So one of the other principles that we have to look at is that although we isolate a single chemical, we have to be aware that many of the other chemicals are left behind. So herbal medicine is not the same as drug medicine. Drug medicine is a strong aspect of one of these principles of this particular herb, but it has many other uses. This is very important in terms of separating herbal medicine from drug medicine. The plant will be familiar with everybody. It's Salix alba, the willow. This was one of the very important herbs which was used back in Egyptian times. They have papyrus which talks about the medicinal use of this plant. It was also used by Hippocrates himself, and Dioscorides, who were very ancient herbalists, which actually set the foundation for much of our modern medicine. So this plant here, they decided to isolate the active ingredient. They named it after this plant, salicylic acid. Obviously the painkiller we now know as aspirin. However, the name aspirin comes from another plant. This plant, meadowsweet, is a very old traditional European herb, and its old name was spirea. This also contains salicylic acid and is also used for pain and also inflammation. So Hoffman, when he discovered this, he extracted from this plant, named aspirin after spirea, and this is why it got its name, aspirin. Despite the extraction of many very powerful drugs from these herbs, people still like to use herbs, and in fact herbal medicine is still very popular. And you could ask why this is the case, because you would think that people would prefer to take drugs. But this herb here does indicate some of the reasons. This is Hypericum perforatum, or St. John's wort. St. John's wort has been shown in its whole extract to be very effective against depression. In fact, as effective as antidepressants, drugs, but with a lot less side effects. And it's these side effects that people don't like with drug medicine. The chemical analysis have shown that it contains a chemical called hyperfluorin, and this acts to metabolize other drugs that are taken at the same time. This makes it very dangerous to take with other medication from the doctor. because it makes them less effective. Many other drugs are affected by this, including the birth control pill, HIV formulas. Many drugs are over-metabolized by this particular herb if taken in conjunction. And so as a doctor you need to be aware what people are taking herbally and have maybe some more training and ask patients what they are taking. We're now in the Chinese herb garden, and as with the European herb garden, the design of the garden reflects the thinking behind the system of medicine, which is very different with Chinese thought. Whereas Western medicine is, as I say, reductive, it reduces variables with its research. The Chinese really like variables. Everything is variable, everything is unique. This makes it very, very difficult to research. Everybody is individual. The formulas are individually made up. And so this is very hard to do research with this type of medicine. So the garden is laid out according to Chinese medicine. Chinese medicine is based more on weather principles, you could say, because the way that Chinese medicine has developed is that they have observed changes of illness or patterns of illness according to different seasons, according to different conditions, and over a long period of time they have built up patterns which you would more likely call syndromes rather than disease patterns. And the art of Chinese medicine is in the diagnosis of these patterns. The principles of Chinese medicine are described on this sign, and basically this concept of yin and yang is very difficult for Western minds. So what we've decided is to divide it into herbs which reduce excess and herbs which tonify deficiency. These are the two first principles of Chinese medicine. So excesses include heat, damp heat, fire poison, which I'll describe later on. Tonics are things like energy tonics, blood tonics, also calming the mind tonics. It's interesting in Chinese medicine because it's not reductionist, it doesn't separate body and mind, so you can treat the mind from the body and vice versa. There are a lot of ideas here which are very different in ways of thinking. One of the real strengths of Chinese medicine is the use of tonics. Many patients or members of the public are taking Chinese tonics, and it is very useful to know what effect they're having. Probably the most famous one is the ginseng. This ginseng root is a very, very well-known tonic for most people. The evidence has shown that the chemicals responsible are called gingenicides, and gingenicides are what are called adaptogenic. Adaptogenic is not a very common term used in medicine, but it means that you can cope with stress better, helps you deal with stress on an emotional, physical and mental level. Very well researched plant. Other herbs in the tonic section include peony root. Peony root is a different type of tonic, contains pinaflorin. Now peony root here is for tonifying the blood. You have to know how to use these plants because they're not tonifying the same part of the body, and the only way you can do that in effect is through Chinese diagnosis. Now Chinese diagnosis is developed without the use of equipment, unlike traditional modern medicine. So basically you take the pulse, you look at the tongue, and you use the symptoms. And these three give you a constitutional diagnosis, and it will tell you which type of tonic to use. Another ginseng is this Siberian ginseng, which is often confused with Panax ginseng. Siberian ginseng is from Russia. It's used by Russian athletes for increasing stamina in athletics, but the chemistry is very, very different from the Panax. This contains eleutherocytes. Now these particularly used in Chinese medicine for stress and old age affecting the back. So you see, although they're all called tonics, they all have their own uses according to Chinese medicine. Another very popular Chinese tonic presently is called goji berries. It comes from this plant, Lycium barbarum. This is a very safe herb. Can be taken long term to stop the effects of aging, they say. But the reason it does that is because it tonifies blood and kidney jing, which are connected with aging. This is the Chinese red sage. Now, it differs from the European sage that we looked at. It has no smell. It's one of the most important plants in Chinese medicine. It's what we call one of the emperor herbs. The formulas are designed according to emperors, deputies, assistants and envoys, and they're built up like individually for the patient. So this can be used on its own, but it's very unlikely that you would use it on its own. But the emperors can be used on their own, like ginseng. And this is called danshen. Danshen is Chinese red sage. We don't use the leaves, we use the roots. These are the roots of the danshen. And the effect of this plant is to move and tonify the blood. Not tonify in the same way as the tonics, but to generate new blood by moving blood. So therefore it's very effective for any situation where the blood is stagnating. So this is an ideal herb for coronary disease. The important thing to remember with these all herbs in Chinese medicine, particularly emperor herbs, is that they have a character which covers many different aspects, because we're using a whole herb rather than just a single extract of tanshinone, which is the main ingredient that does cause this effect. You have to learn them in terms of their wider picture. So this is known as a cooling herb. It moves and tonifies the blood, but also it is mentally calming. So this has other chemicals in which calm the mind. As I say, the body and the mind are not separate in Chinese medicine, and so you can use herbs for both areas at the same time. Now, the reason that you would use this herb, again, you would go back to the traditional Chinese diagnosis and look for situations where there is blood stagnation with heat in the body and also agitation. So it makes it ideal for people who are, say, suffering from post-coronary conditions, or older people, for instance, and it moves the blood stagnation in the whole chest area. We're still in the excess herb section. This is the plant that we saw in the European herb garden, and this is the Chinese hawthorn. It's a much larger berry than the European one. But it has very similar uses. In fact, the Chinese have learned a lot from Western herbal scientific analysis of this herb. It's shown to have at least 4 different chemicals which have a very specific effect on the heart. In all herbal medicine I've ever been to around the world, they call this a heart herb. I went to the Sinai desert, for instance, and they have Crataegus. They called it a heart herb. So it's been common consensus. But the reason that it works so well on the heart is because it has very distinct actions, some of which are even contradictory. It increases the strength of pulsation of the heart, but at the same time it dilates the vessels, the peripheral vessels, so that it doesn't increase the blood pressure. It also slows down the heart. It has a really good strong effect, at least 4 different effects. The other effect it has, and the Chinese have used it for this, is it reduces cholesterol in the body. So this is a natural cocktail, if you like, of drugs, which are similar to taking beta blockers and statins and several European drugs at the same time. We're in the section here which is part of the reducing section, and this area here is called resolving fire poison. Now, although these sound strange names, they are translations from Chinese, and there's a lot of confusion comes about when you use translation that use terms such as the liver and the heart, because people think you're talking about the same thing. But fire poison is very easy to understand as translation. It contains a lot of fire, a lot of heat, and it contains poison, which is pus, infection. So these are herbs that deal with infection. They deal with infection or inflammation in different parts of the body, such as there's ones for colitis, there's ones for lung infection. They can target different areas of the body. They can target different microbes which are in the body, or they can just cool the body down. So sometimes they're added just for their cooling property without having to have poison there. Often used as supplements in cancer treatment as well. So this one here is Yu Xing Sao, and this one's particularly for the lungs, very good for lung infection. These are essentially what we would call antibiotic herbs, and this is an area where it has a lot of potential for the use of herbs and medicine, drug medicine at the same time. This is the ethnopharmacology bed, which is an attempt to integrate Western scientific approach to Chinese medicine, and we focus here on drugs and herbs which are useful for antibiotic resistance, which is obviously a big problem. The problem partly with antibiotic resistance is that using a single chemical antibiotic, the organism can evolve fairly quickly for a defense. Now, plants over the millions of years they've been around have chemicals in that have become redundant, and then they've developed new chemicals. So often within a single plant you will have 4 or 5 antibiotic chemicals which have a different strategy. So therefore it's very hard for a bacteria to evolve against 4 or 5 strategies at the same time. What this bed is about is trying to look at the synergy between herbal medicine and modern drug antibiotics. There is some evidence that if an organism has become resistant to an antibiotic, if you give that antibiotic with a herb, a particular herb, then it becomes susceptible again. And the reason is that the plant does have these microchemicals which have different strategies which can open up the bacteria or the organism to become susceptible to the antibiotic. There are many examples of this. This Artemisia annua, Qing Hao, has been very effective in treating malaria, which has become resistant to malarial drugs. But all these herbs have got potential, and they have particular chemicals in which have this effect. One example of this is one that will surprise people, which is the Japanese knotweed. People are a bit surprised we're growing that in the botanic garden. This is contains a well-known herb for antibiotic resistance and also for treatment of cancer, and so it has some potential in this area. The idea of these two gardens can be summed up by this sign here in the Chinese herb garden. What we're trying to do is combine Eastern and Western approaches to medicine, but we're not trying to say that one is better, one is worse. They have strengths and weaknesses, and our job is to try and integrate these two. It's not a problem in China. They do this all the time. And I've worked in hospitals in China, and they decide if someone needs drug medicine or herbal medicine, usually based on how severe the condition is. If someone has a severe illness and the blood tests are showing derangement, then it's usually Western medicine. But if the disease is more mild, on particularly preventative disease, they would use Chinese medicine because it's more individually based and it has less side effects, and it has a very big history of its use in preventative medicine.